Hey everybody, Dr. Tim here. I want to talk to you about neuropathy and the dangers of neuropathy. One of the reasons why I'm so passionate about neuropathy is because my own grandmother, when I was about 18 years old, she ended up in a wheelchair. So for the last 5 years of her life, my 18 to about 23 years old, she was in a wheelchair. Well, she was in a wheelchair because at the point, at 18 years old, you don't understand why your grandmother ended up in a wheelchair. So I thought, you know what? Grandma is in a wheelchair because she has diabetes and, she's overweight and she can't walk anymore. Well, 2 years later, we found out that she had an infection in her foot. And when she came back from the hospital, her foot was gone, her right foot. And I said, what just happened? She went in a wheelchair, came back missing part of her foot. Well, it turns out that she had an infection in her foot, and the doctors have to cut a few inches above the infection to make sure it doesn't infect the whole leg, because the infection already got to part of her bone. So that was a life-changing moment, because my grandmother, when I was in Hong Kong, was really one of the main persons that took care of me. Mom and dad worked a lot. My grandmother, my grandfather, grandfather worked too, but my grandmother stayed home and watched myself and my younger cousin. And, watching her do everything to being on a wheelchair was definitely life-changing for her. It's life-changing for all of us, right? But having her go from being in a wheelchair to having her foot amputated, and my aunt had to come home and change the dressing on the amputation because we weren't, she couldn't stay in the hospital very long. So she had to come back, and my aunt, thank God, was a school nurse, but she would do wound care, on an open wound and change the dressing, the wraps and everything on that leg, with the missing foot. So that was very, very life-changing for the whole family. I could remember vividly the smell of my aunt changing the dressing, because the fresh wound and the flesh, because it's there still, very vividly in my mind. But I never really knew what it was. I didn't know that what she had was diabetic neuropathy. It was like the end stage of diabetic neuropathy. She only lasted a couple more years after that. Kidneys were failing, liver failing, heart failing, and even in my early 20s, I thought that was just a natural part of aging, right? She just naturally just aged, and it just wasn't a happy time for our family during those few years. So, well, then my life became where I became a doctor, and a few years into being a doctor, one of our patients had neuropathy, and she had very similar symptoms to what my grandmother had. She was diabetic. Her doctor told her that she better, take care of her feet. And I told her, I said, I know what happens to the foot with neuropathy. I said, my grandmother went through this. Well, this patient went to Arizona for neuropathy treatment. And I said, wait, there's actually a cure, that there's treatment for neuropathy, like neuropathy can actually get better? Growing up, I saw my grandmother go through this. Her doctor says, she just has to keep taking pain meds. She takes pain meds. She took metformin or similar insulin drugs. She had an insulin pump at the time, or not an insulin pump actually. My aunt actually gave her insulin shots every single day. And I was told that there was no cure. We learned in school that there wasn't a cure. In school, we learned that we learned what neuropathy was, finally, when I was in school. But we never knew that there was a cure for it. Well, this patient was going to Arizona for treatments. And she came back and she says, I went through this treatment program. I'm better now. I'm at least 50% better over the last few months. I said, what? What is this? So I started taking a deep dive because my first thought was, I didn't know there was a treatment for neuropathy pain. You know, the last few years of my grandmother being in a wheelchair, could it have been prevented? Could it have been made her life maybe more comfortable? Could this treatment prevented her from losing her foot? Right? All these thoughts went through my mind, and I started looking at seminars to go to. You know, for patients who know me, I'm a big learner. I'm always a student because my mindset is I'm always going to be a student. The reason being is because even the best of the best have to keep learning. If we're not learning and we're looking at all the same things all the time, we're not improving. So I don't like to think of myself as, you know, the master in anything, because a master to me means that you can't learn anything anymore, right? So I'm always going to be a student. But I went to a seminar and I realized there are doctors around the world that have been helping people with neuropathy. This just blew me away. And I immediately took what I learned there and started applying it in our office. And it turns out the first time I put out a newsletter on how we can help neuropathy, we had 2 other current patients that has neuropathy that I never knew about because they came to me for sciatica problems and lower back problems, not neuropathy. So from there on, this was 2015, 2016, we started taking care of people with neuropathy, right? And we've been able to help many, many people with neuropathy. And really I think there is a huge misunderstanding on what neuropathy actually is. See, most people think that neuropathy is a nerve problem, right? Neuropathy is not so much a nerve problem or the disease of the nerve as much as it is a blood flow problem, a lack of oxygen problem in your body. See, diabetic neuropathy is one of the most misunderstood It's prevalent, which means that it happens to up to about 70% of people with diabetes. You'll get some form of neuropathy. It is deadly because with diabetes, once you get it, it's not something that our medical community say you can get rid of, right? Once your A1C is high, your A1C is gonna be high, okay? I recently talked to a patient where he was diagnosed 10 years ago, and yet no one has talked to him about nutrition. They put this patient on glipizide, metformin. Eventually, there's no doubt a lot of our patients or people who have came to me for help are also on insulin shots, insulin pumps, and then you rely on that for the rest of your life, wondering why eventually also your organs stop working. See, to really understand what neuropathy is, you have to understand what diabetic neuropathy, how it actually causes that problem with neuropathy. What is diabetes? Diabetes is too much sugar in the blood. When they check A1C, they look at the hemoglobin, and over the last few months, how much sugar is attached to hemoglobin. They give you a number, right? A1C Normal is 5.7 or below. It gets higher and higher and higher. Over 7 or 8, it becomes pretty severe. At 10 and 12, that is very, very severe. So too much sugar in the blood. What does too much sugar in the blood do to your blood vessels? It's like acid to your plumbing. It eats away the lining of the blood vessel. So when it starts eating away at the lining of the blood vessel, you start losing oxygen to the areas where you have blood vessels, right? That's what blood vessels do, is carries oxygen and red blood cells to those areas, okay, to keep it alive. We need oxygen, folks. So it affects furthest away from the heart first. That's the first area that gets the mostly affected. What's furthest away from your heart? Your feet. That's why most people with neuropathy start having a problem with their feet. So what does the body do? The body then senses that there's low oxygen to that nerve, and the nerve starts to die off. As the nerve starts to die, the nerve is not dumb. It's going to signal to you that there's a problem. So it sends a pain signal, a burning signal, a tingling signal. Okay, everyone's signals are a little different, but it sends that to your brain. And now you're like, whoa, why is my feet tingling? Well, most medical doctors and most hospitals are going to correct that problem utilizing pain medication, right? Well, why don't we give them some pain medication, this person some pain medication or anti-seizure medication? These are your gabapentins, your Neurotins, your Lyrica, and Cymbalta. Anti-seizure medications are given. You have to understand what a seizure is. A seizure is an overactive brain. When the brain overheats and it seizes up, right? It stops working. It's like your car overheating and it just stops, right? Radiator is not working. That is what a seizure is. Okay, something stopped working. So an anti-seizure medication prevents overactivity or overheating of the brain. So literally what an anti-seizure medication does is that it slows down or it turns off your brain slowly. That's why these medications have side effects like forgetfulness, clumsiness, fatigue. You shouldn't operate a car. How many people are driving around with gabapentin? Looking at the label, it says don't operate heavy vehicles, right? Or operating machinery while you're on a lot of these drugs. Okay, there's a reason for that. So then the medical model really for the last 5 to 10 years is to turn off your brain so you don't feel the pain signals coming to your brain anymore. Well, your body is not dumb. It knows that you're not hearing what it's saying. So it's going to shoot up more pain sensors. And a few months later, now you have more pain. You're taking the same medication, but now you have more pain. So you increase your medication. And then you increase it to the point where you can't increase it anymore. And I believe the gabapentin is at 3,600 milligrams a day, where that you max out. But the problem isn't getting fixed. The cause of the problem is still there. The lack of oxygen is eating away your nerve. Why is it that in diabetic neuropathy you have to check your feet all the time? Is because eventually, if you get a cut, you don't have enough oxygen in that area, so then you end up getting an infection, right? So you end up getting an infection. If the infection is bad enough and affects the bone, that's when they have to amputate. Unfortunately, that's what happened to my grandmother. And I have a complete understanding of how that works now. So the key is you have to increase oxygen, okay? You have to do that. Now, I'm not trying to sell you anything on what we do, but you have to understand what it is. See, our patients are really happy that we have a program to help people with neuropathy. But the reason why I'm doing this video, so you have a good understanding of why you need help, that you going down the same road is not going to work. You know, yes, do I want people who have neuropathy symptoms to come into our office for a test to see if we can help them? Absolutely. That's been my passion for everything, whether it's for neuropathy, knee pain, sciatica. That's why I'm a doctor. That's why what I do is to help people. But the bigger reason for me is I don't want anyone to have to go through what my grandmother went through and how it affected our whole family if you don't have to, right? But there is a time where neuropathy has gone too far. If we test you and you're past 85%, okay, of nerve loss, and we test all the sensory as a 10-point exam, then it's gone too far. Okay, at 85%, science shows that the nerves can't come back. Imagine a plant in your garden. You know that if the plant is too far gone, you can't bring it back. No matter how much nutrients you put back into it, how much you water it, how much sun it gets, it's not coming back. Same thing happens in neuropathy and the nerves, and the peripheral nerves in your hands and feet, especially the feet, because it's already so far away from the heart that if you don't catch it early enough in time, the oxygen can't bring that nerve back. So I hope that this, after hearing this, you have a better understanding of what neuropathy is and why I'm so passionate about neuropathy. See, neuropathy is more than just a pain, right? You get pain in the feet. It's more than just pain in the foot. Think about how it's affected your life. But not only that, think about how it's affecting or going to affect your family's lives when they have to take care of you. For me, it was watching, my grandmother, she lived with my aunt who was living on the 3rd floor. And in China, there's no elevators, right? So literally we have to help her up the stairs, like lifting part of the wheelchair. I mean, it was, when she was able to hobble on her feet, it was a little easier. Towards the end, especially the last 2 years, I don't remember her going out at all after her foot got amputated. So she was always at home, stuck on the 3rd floor. And that was it, for the last 2 years of her life. And eventually her kidneys and liver failed. So, but I just, from the bottom of my heart, I wish that I want you to take better care of yourself. Take better care of yourself, especially if you have diabetes. Do not take it lightly. Do everything that you can to change your lifestyle. Change your lifestyle, right? Top nephrologists, which is kidney doctors, medical doctors in the world, have seen reversals of diabetes, right? I've seen that happen. I've seen people do better, and their A1Cs and their sugar levels went down to the point where they don't even have diabetes anymore, right? We see that in our office, right? I'm not saying we treat diabetes, but I've seen major changes to diabetes based on lifestyle changes, So, and take this learn about it, learn about neuropathy. Every single week, what I try to do is give you guys information on how to improve your health, function, and longevity. I wish someone did that for me and my family when I was younger, but now I do that for all of our patients in my family, right? But you got to make these changes when it's early and not wait when it's too late, okay? All right, folks, this is Dr. Tam. And I hope you learned a lot about neuropathy today. Have a great day.